Delighted to welcome to the podcast former physio of the Bath Academy, Conor Farrell. Conor, welcome to the show. How are we?
Good to see you, Daniel.
Thanks for joining us, Conor.
No issue at all.
Conor, listen, before we get into a little bit about your physio career, I want to talk a little bit first about rugby, your first love. Can you tell us a little bit about getting involved and playing rugby?
Yep. So I started playing around 11 or 12 when I started going to town year school. Played the whole way through. Played juniors, seniors, etc. Graduated, went to UCD, and didn't obviously go anywhere with union, so I decided to switch to league. Played and represented through university. Was the student captain the second year I did it, and then afterwards I went to do kind of half a semi-pro season over in the UK with a team called Hemel Stags. And then tried to do a little bit with the Irish senior rugby league team. I managed to get 3 caps in the end. So I played England, Scotland, and then against Fiji. And unfortunately hurt my knee in against Fiji in 2013. And then kind of just stopped playing after that for seriously, and went back to kind of social playing. So played in the IAL with Sunday as well. And then kind of moved into just doing the physio and performance stuff up with Malone in Belfast. And then slowly started to realize that that's what I wanted to do for my job. Went back, did a master's in sports and exercise medicine, and then went over to Bath, being a full-time physio in the sport.
Just before we move on to that, tell us a little bit about playing for Ireland in rugby league and that move.
Look, there's no, I suppose I'm only 5'9", and I was playing 7 at the time, and I don't know if anyone remembers my year in 08, but like Peter Manny's still playing, Jordy Murphy's still playing, Dominic Ryan, and there's a lot of flankers that year, and it just wasn't a good time to be a very, very short 7. So I was always very, very fit. And league just suited me. I was much better at it. I got my hands on the ball more. I was making more tackles. I could run more meters, and it was just the engine style of the game just suited me a lot more. So I kind of excelled at it a little bit. If I'd played it since I was a kid, I probably would have done a bit better. Like there's no greater honor. Like obviously it's a much smaller sport in this country, but you still feel a ridiculous amount of pride to pull on a green jersey in any sport. And yeah, it's definitely a bit of a highlight in my life, and I really, really enjoyed it. But it was short-lived.
So listen, move on to Bath. How did that opportunity come about? Because you obviously, your injury, you said you really wanted to pursue, I guess, something that you're already doing anyway. But how did that opportunity come about?
Yeah, so that's fair. So I was in Malone up north, and basically Malone did a bit of a restructuring and wanted to move back to AIL 1A. They're a pretty decent team. They're definitely the best team in Belfast, and they wanted to be the best team in Northern Ireland, move back to 1A. So I was brought in, did performance and S&C, kind of injury prevention stuff, and did the physio on match days and in general physiotherapy and maintenance of players. We had a system put in place that was kind of new at the time, which is now kind of adopted everywhere in terms of high-speed exposure and a lot of different exercises to reduce soft tissue injuries. And we actually had none that season. So we had no calf strains, no hamstring strains, no rec fem, which is the front quad for sprinting. And those are usually the high-speed, non-contact injuries that you usually see in teams. So we did really well, and they've been promoted to 1B at this stage, but haven't achieved 1A yet. And yeah, they did really well that season and did really well in the subsequent season. So I was pleased for them. But I had applied then to go to Ulster. And I had talked to the head physio there, and he just said, look, if you're moving into the sphere from AIL, you kind of need a master's. So I just said, all right, I'll go back, I'll bite the bullet and do it. So I did that full time for the year in Trinity. There were a number of jobs available that summer. I interviewed at Worcester, not Dragons, Cardiff and Bath, and Worcester and Bath offered me 2 roles. Worcester offered me the senior A-cap position, Bath offered me the junior, and I took the junior because Bath suggested that they were going to be this very, very progressive academy-based system, and ended up being that. And so I chose to kind of go down a level and go into Bath then and move over.
You mentioned soft tissue injuries and working on that. What's exactly the program involved in terms of, because it's a very, like, I know just our GAD clubs come back and non-stop injuries. We don't have a full-time physio, for example. How do you go about? I think that'd be very
so it is. I suppose it all kind of starts at preseason and what the actual strength program is in the gym. It's very, very tough to kind of no one size fits all. It's really, really tough to do it at an amateur level. And I suppose I was just blessed with the fact that I was quite young, so I had a lot of time. I definitely wouldn't have the time to go in and do this now, but the equivalence of putting in very early on some very heavy eccentric exercises, starting people off on Nordic hamstring exercises, and getting them doing a lot of that pre-season. A lot of calf-based exercise and capacity work people really wouldn't usually do in the gym. You don't see many people doing weighted calf exercises. And then a lot of single leg Bulgarian split squats or sprinter squats, depending on which the player liked better. And from there, you've got three pretty heavy capacity-based exercises for the three main groups of the lower limb that are injured in rugby. So if you look at basically what you do when you're trying to make a program to reduce injury risk, you look at an epidemiological study which shows you over a season how many injuries occur at different muscle groups. So for the lower limb, the main ones that occur from sprinting or just soft tissue in general, that no one's hitting someone, so not a non-traumatic injury. You have your medial calf, so the inside calf muscle, which is the one that's producing the most force. The lateral hamstring, which is the one in the most strain when you're at high speed. And then the rec fem, which is the longest quadricep muscle. So it flexes your hip and extends your knee. So it's also the muscle used for kicking in, say, Gaelic. So when you go back and you do a load of sprints, followed by a load of running, followed by a load of kicking practice, you end up overloading that a lot. So I'd see the rec fem more in Gaelic than I would in rugby. But all three of those are the most prominent kind of muscle injuries in field sports.
Okay, so we'll move on to them in a minute. So back onto Bath. So your job then was essentially come up with the same program you'd done, but bring it to a professional academy.
Yeah, not necessarily, which is great because I didn't have to do that because I had an S&C coach with me that was very, very good at his job. And there was already there was already a good bit of a program in place. He understood a lot of that already. So his professional job, I just had to do both jobs in the capacity of an amateur club, whereas in a professional setting, you have S&C coaches around that are much better than me at, say, coaching technique, at managing load. We'd consult on the injury prevention part of the program and go from there. But obviously, when you have two people, you're working in a much more dynamic team setting, and you do much better. So the program, I would have said in the Bath Academy once I was there a month, myself and Alan Murdoch, which is his name, it was actually much more robust than the program I would have done previously. And yeah, so that went very well. And my job was more, I suppose, then like being in the gym with Alan when he had full kind of 18s, 19-year-olds being in there for a session. Well, not 19 yet, but the kids we were going to sign the next year. So I'd help him. He trusted me to check form, but obviously he's still the better coach in terms of teaching players. And then I trust him to kind of go through a rehab program with an injured player, for instance, that like even if one of us wasn't there, we kind of trusted each other that way. So it's a much more team environment.
What kind of injuries are you seeing, historical injuries that the 17, 18-year-olds are bringing with them into the academy?
Yeah, it's pretty tough that way. So basically, gathering a history is really difficult. Obviously, like it's becoming much more traumatic for young kids nowadays because of the introduction of weights early, and that's not a problem. I don't have an issue with kids lifting weights, but the fact is, kids are getting stronger, faster, etc. So you actually see quite a lot of injuries early on in kids' careers. So like, for instance, in our 18s group that year, I had a hamstring torn off the bone. There's a labrum tear through two different shoulders, with two meniscal tears in different knees, like arthritis in a big toe already, like things like that were just from massive amounts of force over and over. So you see quite a lot of traumatic injuries in under 18s players, even now in comparison to senior players. But obviously, senior players are playing a lot longer, so they'll accumulate them over the course of a season. But yeah, you still see them under 18s level. And then other than that, it's the ones kind of I've already discussed. And then the ones that are specific to kids are kind of growing pains. So there's very specific injuries that you look for in teenagers that teenagers usually get that I kind of have to check the squad for. So things like osgood-Schlatter, which is just basically knee pain below the kneecap where the quad's attached to the plateau in your shin, and when you're growing or get taller, the tendon starts to pull at that bone and can make it painful. So that's one of the things that kind of comes about with it. And then there's a few others for like kicking and hamstring based injuries or foot pain called severs. So you look for those teenage ones kind of specifically, but more so they just have general rugby injuries.
And what's that like working with the academy? So obviously a lot of those players aren't going to make it. Would you give us like a percentage in terms, because just recently on the podcast a few weeks ago we talked about players not quite making it and what kind of measures were in place? I suppose it'd be interesting to hear for a professional club like Bath what measures were in place.
So I have probably an interesting perspective on this because I lived with the analyst, who was a great guy, His name was Rowan, and we lived together for 2 years. And you'd see kind of the highlights put together, but the problem is that only about, like, realistically we'll sign somewhere between 5 and 6 players in a season, at most. Kind of, it depends on the year, it depends on the needs of the club. So for instance, like, even this year, I know, like, I've left, and I know one player, like a couple of players were signed just because of positional depth at the club, and like in the future they don't have X players, so they're going to sign him because someone shows promise in that position. It's not necessarily the 600% out and out best players at 18 years old. From my perspective, the coaches look at, like, the coaches are there all year round. They're supplied by Bath. It's a great system in the UK called the ACE system, where they go into a school, they produce players from that school all year round, and then the 18s are from everyone in the district. So they have some players that they have access to all year round, and some players they only have access to for 18s. And some of the people who make the decisions beyond those coaches who coach the 18s either only watch the games or watch the analysis. So it's very difficult to make a decision on, say, character, for instance. So myself, the S&C coach, would probably have some different opinions to who is eventually selected, because we see them work in the gym and on the pitch week in, week out, day in, day out. Or someone gets injured and we see how they come through injury, and we might say, you probably want to sign that guy because he's going to do really, really well in a professional environment, but that might not always be taken into account. So it's very tough. Basically what I'm trying to say, after I've rambled through all that, is there's a multitude of factors, and sometimes it's not always objective. Sometimes it's the guy who comes around for the 4 games of the 18th season and does well, and sometimes it's just the needs of the club. They might just say, look, we need a scrum half this year, so like this guy looks like he's going to be okay, so at least we now have a squad scrum half, and if we need to sign a better scrum half in the years to come, we'll do that. And that's kind of where, like, they're trying to build up a squad, not necessarily get a star player out of every 18 squad. So that's basically.
Do you reckon a lot of players will slip through the net then? Like you mentioned, that could potentially have had careers.
Yeah, so there's definitely 2 or 3 over the last couple of years that I would be very surprised didn't get an opportunity. There's definitely a few this year in particular, and that's just the nature of the game. Like, people think sport is this last great meritocracy, but it really, like, you need a lot of luck to get to some positions. Like, obviously there are some absolute freak athletes that are definitely going to make it no matter what, but it's the squad players in between that are going to be there week in, week out, that you kind of, it's a lot of it is 50-50 decision making, and it's, you know, one very good center might make it, but like another very good center might not, or, you know, these positions that are very much physical and what's the word I'm looking for, athlete-based positions versus very skill-based positions. So like a 10 or a 9 or a hooker, for instance, that all have a very specific skill set. You probably know that they're going to do well and that you're going to select them pretty early. But like if you're having a choice between a couple of flankers and a couple of centers, it's very difficult to know exactly which one is definitely going to make it and which one's going to play the best for the most number of years.
How do you work between working with a hooker to a flanker to a fullback in terms of injury prevention and in terms of strength and conditioning programs?
Yeah, so it's a really interesting question. So there's a couple of ways of doing it. In the professional game is a lot easier because you have GPS and a lot of metrics. So if you have a fullback, they're going to play and have different activities in the game to a hooker. So basically at the start, everything's kind of the same. You see an injury, you diagnose an injury, you might need to get a scan, and then the player has a few days of rest and he's back into doing rehab. If it's a lower limb injury, their upper body programming kind of remains the same. If it's and vice versa. And then you kind of bring them through a slow rehab process at the beginning, where you're trying to get their full range of motion back, or be able to move the joint or muscle as much as possible and get back loading it in a safe way. Then you get them back doing power-based exercises, and it's more the differentiation comes where it's towards the end of rehab, where a fullback is going to need to do, you know, a good few sprints, a good few jumps, a good few kicks, whereas a hooker is going to need to see, can he sit down in a scrum a lot? And it very much depends on the injury. Obviously, there's hundreds of permutations because there's hundreds of injuries, so I'm not going to go through it, but basically it's more the end of treatment, the end of rehab, that makes it so different. And, you know, a fullback is definitely going to focus a lot more on explosive efforts in the gym, explosive plyometrics, and kicking, etc. So and kind of like backfield positional play, whereas a hooker is going to have to get a number of scrum reps to make sure that, say, his ankle is going to be able to get down for 10, 12, 15 scrums in a game. And you'll plan that with coaches. So you've skills-based position coaches. At the 18s, we always had a forwards and a backs coach. So you just organize with them to get these people those reps. You'll have the forwards pack there to integrate into that system. So like everyone was kind of helping each other in that sense at the end of rehab, whereas at the beginning it's very much just the physio and S&C coach planning early stage rehab.
Would you have any kind of common examples, or you mentioned a couple of examples there just before we came on air, in terms of players? Was it the players that you'd worked with before that didn't quite make it yourself, or what kind of examples were your case studies were you talking about?
You mean for injury or
for injuries? Yeah.
Yeah, so there was one very, very, very good centre that unfortunately did his ACL before his 18th season and then didn't get selected, and realistically was probably one of the best players I'd ever seen at that age group. 6'3", ridiculously fast, like lean, strong, like just everything that you'd want, and then extremely skillful as well. I think probably that year is a very formative year as well, so knocked his confidence a bit. But like I think during rehab, I came up with a specific drill about catching passes, receiving, and then like running through the defender and sidestepping. I think one time I gave him a crap pass and he picked it up off the ground by his fingertips and then chipped the S&C coach that was going to be defending him and caught it again. And he was just sitting there going, like, the guy's just come back from an ACL injury. It's his first time like doing any sort of change direction drill, and he just showed off something that I haven't seen any other player do in the entire time I've been here, let alone professional or 18s. And unfortunately, just because he got no exposure, they hadn't seen him play. And we've been trying to decide between two centres the year before. One of them has subsequently made it very, very difficult. He didn't get any 18s games the year before. He only played under 17. So he never got exposure to then show what he was worth. And this year he got a couple of things going on, but like it was just very, very tough for him. Whereas if he had never got injured, I would, if I was a betting man, I'd definitely put a lot of money on him being in some kind of professional setup. And so that's like, but that's just, again, that's the look I was talking about. It's not actually sometimes the best players. It is if you can remain healthy or not and show off what you're able to do.
Yeah, and I suppose it doesn't get talked about a lot sometimes. You hear, oh, this player made it for this reason, this player made it for this reason, and they made it through their own hard work, obviously, but those that don't quite get there with an element of luck, or like you mentioned, even getting the injury at the wrong time, I guess, where they're...
That's the big one. The big one is the timing of it. So, like, if he had been in the academy and did his ACL his first year, it still would have kept him. Do you know the way? So, like, if he had been able to show off how professional he conducted himself at such a young age, because you have to remember, like, you think about these guys, like, everyone watches the TV and looks at, say, for instance, the people that were at Bath, like Sam Underhill, Anthony Watson, people like that. They're all actually extremely young. Like, people look back and go, oh, these guys are professionals, etc., and treat them as if they're 30, 35, as if you would in a professional. Like, these guys are only, like, they're mid-20s. Like, so they conduct themselves so professionally for their age that people forget how young they actually are. Like, the guys I'm talking about at 18, 19 years old are much more mature than people I come across in university in general. Like, people kind of like get down on athletes and say, oh, they act this way and act that way. And don't get me wrong, I understand that some people do, but like, I can only say that the guys I worked with were far more mature than I was at 18, and far more than any of my friends were at 18. And, come into an environment every day where they're up at 6 a.m. These have to then go to university and then come back and do whatever number of reps as a prop or a second row or a back. And they're doing it with quite a bit of hunger and then going back and studying in the evening. So, like, an academy system is no joke, and Leinster's no different here. It's a really, really tough thing to put yourself through, and like, those guys deserve a lot of credit, because the academy system right now versus, say, even soccer is really, really tough.
And then moving on to you spent 2 years at Bath, is that correct?
Yeah, so did two and a bit years, so I did 2 full seasons there.
Brilliant. And then you moved back to Ireland, back to Sandyford.
Yeah, so back into a clinic here. I got married, and I went over to kind of try and progress in the job a little bit, and Brexit happened. There wasn't really much movement in my role, and I didn't really find somewhere that I wanted to settle. There was a couple of opportunities in between that I decided not to take, mostly because I didn't want to kind of move within. I wanted to stay and see if I could progress, and then subsequently just like didn't go the way I wanted. So, and when I was getting married, I didn't want to be working 50-60 hour weeks, and especially in the evenings, because the academy is very much an evening based role. I just wanted to come home and start married life correctly, and really enjoying it, enjoying being home as well, like enjoying being in Dublin. So it's nice to be back.
And then just for those listening, how do I word this? So those listening that get injured a lot or don't go to a physio, for example, Sean, Sean here trying to get into go. But I think I know for something I should have done at 17, 18 was go to a physio with no injury and then know where I was weaker. And there's a lot of stuff now that I've huge regrets at. For anyone listening that is at that age or even early 20s or anyone lucky enough not to be injured, touch wood, what's the benefit of going to a physio?
Yeah, there's a couple of bits, and I'll try and unravel that point a little bit, because I suppose you've teed that up nicely for me to kind of make a wee bit of a pitch. So the main thing I would say is that, like, not all physios are created equal. Like, do look at who you're going to. The other thing is that all, like, the private physiotherapy market in Dublin is completely saturated. So there's a clinic on every corner really at this stage. So what you want to do is actually approach someone that you have a good relationship with, that you get on with, that seems to have a bit of knowledge around what they're talking about in terms of sports. What you really want to look at is who's just massaging you and who's telling you how to get better when you leave. There's no problem with hands-on therapy, like as in massage and all that jazz, but like, it's the end product is like, it should be 10% of the thing, whereas the rest of it should be you explaining your injury and then, you know, having a couple of diagnostic tests explaining the injury to you, trying to get you to understand what the process is going to be to get you back, and then going through all the exercises with you in the best way that they can. The other way of it, if you don't have any injuries and you just want to work on something, I would definitely go to a physio who has actual experience with the team, so someone who's kind of done a bit of work around that and has programmed before. So there's a difference between getting someone who's, say, a runner with a bit of calf pain versus someone who has a really traumatic injury getting back, or in general just preparing someone for a high level of sport. So you want someone who's kind of either done some county stuff, someone who's done like actual team-based work for a while, rather than just having been in clinic the entire time. And that would be my big kind of takeaway for this, for anyone looking to go to a physio. The other part of it is how you then send a program to someone. You know, it's grand to go through them with them in the clinic, but like, a lot of studies show that most of the learning goes through one ear and out the other when you're in a clinic, because people are talking very quickly, they're using very large words, and people don't really get the concept. Whereas obviously you've got a program from me, which I think works quite well, which is you have the sets and reps, but there's a reminder YouTube video of as much of the technique that I could find in the best way possible. I think that's a good way of doing it. There are other kind of softwares that do it for you, but they go from like the very early stages of rehab, maybe a little bit in the middle, and they've none of the high end exercises. So like, for an athlete, they're not great. So I usually use YouTube specifically, and that would be what I'd look for from my physio.
So just trying to tailor it to find someone that meets your needs there, and essentially in terms of like team based, like you said.
Yeah, and to be honest as well, though, like someone that you get on with, like, do you know what I mean? Someone that, like, I definitely don't fully connect with every patient, and you know, I try to go about it 3 or 4 different ways until they get the message. Sometimes I don't, and that person probably would benefit more from going to a different personality type if I'm not getting it right with them, and that's okay. You know, it's the same as like if someone's going to a counselor. Like, if you don't have the relationship, because it's not like medicine where I just go, oh, I'm prescribing you this pill, if you take this it'll be fine. Some of it is kind of how you get them to understand what they need to do, and then how do you tailor it to them around their own kind of life environment. So like, you know, if I have a new mother or something like that, I'm not going to give them 18 exercises or 8 like trying to get around like working with like having a baby every day. So you're trying to tailor it to like, it's just going to be 10 or 15 minutes. You can do it in X environment when, you know, the baby's just having its nap and you're beside the couch. There's your exercises you can do at the couch, you know, like those kind of things. Like that's more what you're looking for, is that the physio is actually interested in making it work for your lifestyle. Because doing something is better than nothing, always.
And then last point before I let you go, Conor, just a little bit of the myths around, for example, stretching before, stretching after.
How long do you have?
I was like, I'll ask this very quick because you went on this for everyone.
Oh God, yeah.
But tell us, like, just like what should you be doing before? Does that actually prevent injury? And then say warm ups, warm downs, etc. I know it's a tough topic to tackle.
That's fine. So like, I'll try and quickly run through what is and not what isn't appropriate. I'm not like the authority on anything that is and isn't appropriate, but basically what I would say is that, like, if you think of your match day, right, and warm-ups have now gone from 10 minutes to somehow an hour, right, it's and I don't think injuries are overly better than they were 10 years ago, and people have just gone insane. So I think what people don't understand is that like part of warm up is actually like warming up the tissue, like blood will flow to the areas that you're starting to use. There should be a progression. So you're going from kind of low level and building up to a particular intensity. I would suggest that, you know, a couple of skills based stuff and game planning is important for mental switching on, because that's what you're doing as well. But like there's no need to be going over 15, 20, 25 minutes unless you're doing the very, very like walking the pitch and positional stuff at the beginning, and then it should ramp up to high intensity so that you are warmed up, you go in, put on your kit and go outside. And that's one of the things I would say, that like the warm-up process has got massively elongated. Static stretching is a, what's the word I'm looking for, controversial topic. So people will use it to modulate pain, and that's completely fine. The thing that people don't understand, they go, oh, my muscles feel tight, or, you know, I can't touch my toes. And if I take a muscle biopsy and take a muscle out of your body and I just pick it up and stretch it, the thing can stretch for miles. It's made out of elastin and collagen. It's extremely elastic structure. It's not usually the muscle that's causing the issue. It's either neurological input telling you not to go to a particular range because you haven't done it, or there's been a bit of breakdown in the muscle and it's trying to protect you, or it's osteological. Like I can't move my hips the same way. For instance, my best friend can move his hips. He can like literally turn his hip 180 degrees in both directions. Mine barely gets 30 in each way, and that's because of the way my hips are formed, not because of the muscle in them.
So it's not the actual muscle itself, but the pressure being put on it around the muscle.
So that's, yeah. So apologies. I know this is like, I said like a very long list of scientific words, but like my point is that it's usually not the muscle's fault. It's either breakdown because you've overdone it. With sport in particular, that's very common. People don't have the capacity or strength to do what the muscle is being asked to do, but it's very difficult to do all the training around, to play a lot of Gaelic matches, do 3 Gaelic matches a week. People don't rest enough and they don't recover enough, and they think that stretching is going to help with that. And it, like, most of the time it isn't. They'd be better off going and doing a quick 20-minute bike ride, or doing a little bit of weighted exercise, but only doing 2 or 3 sets. And it's more about the muscle breaking down because you're asking more of it than it can do. That's 90% of the time. Like, stretching is not going to change that. What stretching might do is help you with DOMS, or help you with a mild amount of pain, and it might reduce those symptoms. But in the long run, unless you're a dancer, unless you're a contortionist, unless you're something that really needs flexibility like ballet, there's really no need to be pressing yourself into pretzel-like positions. It is more about preparing yourself properly for the demands of your sport.
And Conor, so where can people find you if they want to get in touch in terms of physio appointments in Dublin?
Yeah, so I'm currently in a clinic called Total Physio in Sandyford. It's literally opposite the Sandyford Lewis stop, and yeah, appointments are kind of 30 minutes in length at the moment, and we have like full cleaning post-COVID, etc. So it's kind of, after each patient, we clean down the entire room. And yeah, so it's a really nice, safe environment to come to now if you want physio at the moment. So I definitely, if anyone needs anything at the moment, because obviously a lot of people are out and active, doing running, doing cycling, just pop in. Our website is just Total Physio, and you'll find it just if you just Google it.
And highly recommended by myself. So you can't get,
thank you, Daniel.
Can't get higher praise than that. So we've linked all the details in the description there, guys. So check it out. But yeah, Conor, thanks for coming on.
Thanks very much, Daniel. Have a good day.